the socio-economic impact of COVID-19 among the youth in Ethiopia, Kenya, and Uganda. This regional dissemination webinar is organized by OSREA, Organization for Social Science Research in Eastern and Southern Africa, Makerere University, CCRD, Consortium of Christian Relief Development Association based in Ethiopia, and the Kenya chapter of OSREA. The socio-economic impact study conducted in the 3 countries, Uganda, Kenya, and Ethiopia, is part of the research project called COYOQA, COVID-19 and the Youth Question in Africa, which deals about studies about the impact, the response, and the protection measures in the IGAD region. Having said that, today's webinar program agenda, let me share that. Then, can you see it?
Yes. Yeah, we can see it.
Okay, so the first part was a welcoming remark by Dr. Marta Mutusi, who is a senior program specialist, but she's not able to join us today, as I've told you earlier. Then we have Dr. Tufena Mukuna, who is the executive director of OSREA. She will give us an overview of the project and also an overview of the study in these 3 countries. And we'll be having the findings session where we have presentations by 3 country research leads in the 3 countries. The first presentation will be on the Ugandan one, the findings of the Uganda. The second one will be on the Kenyan. And the third one will be the Ethiopian presentation. Then we'll have another presentation by Dr. Tufena on towards a feminist gender transformative approach in social accountability. Then after those presentations, we'll open the session for question and answers. And finally, we'll have a closing remark. Now, we have some housekeeping items. Please mute your microphones when you are not speaking. But when you want to talk, just click the microphone icon in the bottom bar to unmute yourself and you can speak. If you have any questions or comments, please write it in the Q&A box, or you can also write it in the chat box. And the presenters and other partners or team members of the presenters will respond to those questions. Finally, please be informed that the webinar will be recorded and it will be posted on our OSREA YouTube channel, and also we'll make it available on our on the project website. Now I will take you directly to our first speaker, who is Dr. Tufena Mukuna, who will give us an overview of the project. Thank you. Dr. Tufena.
I want to thank you, all of you, and welcome you to this webinar this afternoon. Before I go into the project, I would like to tell you something brief about OSREA. Some of you may not be knowing what OSREA is. OSREA is Organization for Social Science Research in Eastern and Southern Africa. We have our presence in 21 countries of Eastern and Southern Africa. Our headquarters is at Addis Ababa, Ethiopia. OSREA has been in existence since 1980, so we are 42 years old and 3 months. We are 42.3 months old since its establishment. In the countries where we have our presence, we have, because we are a network of universities, we have liaison officers who are based in our partner universities, and they coordinate all other members of the organization in their respective countries. We have an executive committee at the helm of the organization that does the oversight of all the activities in the organization. So other than conducting research on emerging issues in Africa and the globe, we conduct research, we do capacity building. We also are engaged in dissemination of these researches that we conduct. And before we disseminate, we engage community members who include the policy actors, various actors and stakeholders that we have conducted research with. And so we publish peer-reviewed journal articles and books, and we disseminate these widely. If you check on our website, you will see the kind of work that we do. We partner with both natural sciences and the humanities. So basically we are into multidisciplinary, interdisciplinary, and transdisciplinary research. I want to welcome you to partner with us. We also do fund administration of research projects. So if you have a research project or you would like to have your project administered at Austria instead of universities or your civil society organization, we have a host agreement by the Ethiopian government that allows us to do that. We organize conferences, we will get you visas and the like. So all this is just what Austria does, and our work on the continent is well known. Thank you very much for listening to me. I took the liberty to tell you about Austria because now that our program officer, Dr. Martha Mutisi and Dr. Catherine Toure, the ones who are at IDRC, the donors, were supposed to attend this meeting, and Martha was going to give a keynote speech, but she's not able to come because she's attending another crucial meeting, emergency meeting at the headquarters. So forgive her. Then allow me now to give you an overview of our project. Today, we are going to hear from our researchers in Kenya, Ethiopia, and Uganda, telling us what they have been doing. It has been quite a while since we met again and shared the information that we have. So I would give you an overview to introduce the work that they are doing. As Alemu has already told you, we are a pentagon formed of 5 organizations. Austria is the lead partner, and we have CCRDA from Ethiopia, we have Makerere University from Uganda, we have the Austria Ethiopian chapter based in Kenya, and also IGAD C1. Our research is confined to 3 countries, that is Ethiopia, Kenya, and Uganda. But in our literature review and the work we have been doing all along, we are looking at the whole of Africa because we would like to answer the question of COVID and the youth question. As we all know, when COVID hit, different countries responded differently to the crisis. And it has disrupted the livelihoods of youth so much in terms of access to education, employment, and participation in governance processes, decision making, and general public life. Since Africa is the youngest continent, we find that this has exacerbated the vulnerability and exclusion of young people that already has been existing. Yet, young people have the potential of promoting youth agency by encouraging innovation, strengthening intergenerational dialogue, and promoting social accountability. When COVID struck, the governments responded in a top-down, they used a top-down approach, ignoring the communities that were impacted by the pandemic. The African governments seem to forget that Africa is the youngest continent and the youth have great potential as change agents in their communities. If meaningfully engaged, they can transform their communities. A lot of resources by African governments and bilateral donors, private practitioners and individuals were mobilized and centralized by the governments for distribution with ad hoc monitoring mechanisms. And with this, it has led to the challenges on social accountability. Despite the constitutions of most African countries clearly stipulating or the engagement of civil society, youth and civil societies in their constitutions, still we find that this meaningful engagement is at a nascent stage, especially in the 3 countries that we studied or we are studying. And in areas where they engage, they merely participate in the meetings and present position papers. Responsiveness and satisfaction with public service delivery is often of poor quality, fragmented, and not satisfactory. There is a reported lack of willingness on the government actors to provide an enabling environment and space for civil society organizations to amplify the voice of the voiceless, and this is still a big challenge. Further, lack of technical capacity on both civil societies and local government actors on how to engage makes the situation worse. Additionally, the youth's reluctance to push the accountability agenda and to ensure enforceability also contributes to low meaningful youth engagement in social accountability for good governance. The youth seem not to know their rights, entitlements, responsibilities, and obligations. This hinders them from demanding for their right to good public services and to hold local governments who are the service providers accountable. There is therefore an urgent need to build the capacities of both civil society organizations and local government actors amidst shrinking civil space. In Africa. So that being the case, we thought that the main research question that is guiding this study is how do we ensure that youth-led social accountability programming for COVID-19 is gender responsive, inclusive, and has meaningful engagement so that the voices of the most marginalized are heard and translate into better social services and good governance. This is what has been guiding us. Of course, we have broken this into 5 objectives. We are working in the IGAD region, particularly in 9 research sites. In Kenya, we are in Nairobi, Busia, and Mombasa. In Ethiopia, we are at Addis Ababa, Hawassa, and Somali region, Jijiga. In Uganda, we are at Kampala, Gulu, and what was that other place? Let's move. Masaka, yes. I've already talked about the partners and stakeholders. Of course, this project will benefit very many civil society organizations, academia, journalists, various ministries. So the list is endless. The project is funded by IDRC from September 2020 to August 2023. The research approach that we have taken is, this is a non-pharmacological approach to combating COVID-19. We are not looking at the epidemiology, we are looking at the social science, the behavioral aspects, the non-pharmacological aspects of COVID-19 and its impact on the community. And to do this, first of all, we have done a political economic analysis of the 3 countries to inform social accountability for social justice and good governance. Because when the different countries responded, they first did their political economic analysis. We are using a bottom-up, top-down approach to conduct a gender poverty and vulnerability analysis to COVID-19 in the 3 countries. We have also employed multi-stakeholder and multi-sectoral analysis to give understanding to context, barriers to change, and power dynamics in decision-making at different levels. This is an action research that adopts a gender transformative approach based on the mixed methods paradigm. We are analyzing how youth or young people are transforming the public health and socio-economic landscape created by COVID-19 by advocating for transparent and accountable responses to the pandemic. While doing this, we are also interested in the impact of the responses that the different governments made. The aim is to bridge the divide between the excluded youth and the governments to coordinate responses using data-driven, evidence-based approach. We have 5 objectives. I will mention the objective that we are going to focus on today. The first one, we did a gender analysis of the current social mobilization of youth. Generally a situational analysis of the responses, the response of the various governments to COVID-19. Secondly, we are interested in tracking the gender differentiated sectoral socioeconomic impacts of COVID on youth and their communities, and then documenting the community perception and response strategies. We also are going to now, after we have found these 2 researchers have given us a situational analysis on what has happened, and therefore we will, the third objective is building the capacity. Because of the identified gaps, now we are going to build the capacity. And after building the capacity of the youth and the civil society, of the youth-led civil societies and the local governments, we will also partner with the youth to take action while engaging the policy makers. So the engagement of the community engagement is at 2 levels. It is at the local community level and also with the local local actors who are the service providers in this respect. Now, we have, as I mentioned earlier, this research is a mixed methods, it takes a mixed methods approach. And therefore, we, first of all, did, because it's an action research, we did a stakeholder analysis. We engaged the policymakers, all the stakeholders who are involved to share with them. We did an inception meeting to share with them our idea and what we intended to do. We have conducted literature review for this particular project. And the research is divided into 4 phases. The first phase was the baseline research. The second phase is this socio-economic impact study. The third phase is the developmental evaluation by the COVID and social, vertically integrated social accountability. I will explain what this framework is all about. And therefore, the last research that we shall conduct is the end-line research to find out what has worked, what has not worked, why and where, and document all this. The primary aim of this research is to review and consolidate the latest evidence on youth experiences, perceptions, and aspirations during COVID-19, and to document successful strategies for youth-led citizen monitoring and oversight of public and private resources, and on citizen participation in public resource allocation and decision-making to improve their livelihoods during the pandemic. In our moving forward, we are also going to give recommendations as a team on what we think should be done from what the youth would have told us or are telling us on the way forward. We are working on a vertically integrated social accountability. I had mentioned that it's a bottom-up, top-down approach. At the very bottom, in the local communities or in the villages, we have youth volunteers who are collecting data in the local area from media, village reports, and everything that is happening in this area in regards to service delivery, the promises that the government has made in terms of the policies and the budgets, and the services that they are receiving at that level. Now, this information is transferred to the monitoring, evaluation, and learning coordinators who are at the national level. Now, these ones collected the data from the YOHEPs, media, academia, and civil societies, and forward it to the country research leads. The country research leads then compile the country reports, like the ones that we are disseminating today. And these ones are now then forwarded to Austria, and Austria will do a synthesis regional report that it will forward to IGAD C1 for further analysis. We are mainly working in 5 sectors of the economy. We chose these 5 sectors of the economy because these are the ones that IGAD does all the early warning and analysis on. These are governance, the economy, environment, social well-being, and security. This is generally our research journey. This diagram represents our research journey. At the center of it is the political economic analysis. That is the starting point. When COVID happened, every country responded depending on their political economic analysis. Then from there, we are focused on 5 sectors of the economy, as I've mentioned. And the first thing, our research journey is divided into 4. I have just talked about the methodology, where we are doing transdisciplinary research and all the activities that we are engaged in, the data collection, the literature review, the performance reviews, the mid reviews, documenting the good practices, documenting even the bad practices, the feedback that we are getting from the field as we are sharing this information. We are also, after getting all this information, we are now going to move into capacity building. Now, in capacity building, we have developed a training manual, an evidence-based training manual on COVID and social accountability, whereby meaningful youth engagement in social accountability, where we are now going to build the capacity of the youth, civil society organization, and also the local leaders. Now, that manual, it is rich because it's touching on all areas where we have had deficits. The methods, the tools, the strategies. It is also linking the gender aspects of it and how this can be harnessed, the soft skills, and everything that that the youth need to empower them so that they can take responsibility as a human right to move forward and have the confidence to face the policymakers during and ask for their rights. Then also, while this is going on, we are also doing knowledge management, communication, and dissemination, which also includes community engagement. In this segment, like what we are doing right now, we have collected data, then we are disseminating it. We are also, when we will be using the manual to train, we shall be having community engagement. So the knowledge that we have collected, if you check our website on the COYOQA window, you will see the reports are there. And we have also shared with the core team that is based in IDS, University of Sussex. And they have also shared this information widely. It's on an open airline online platform. We are interested in building the capacity of our youth so that they can hold the government accountable. So the civil society state interaction will be strengthened by this project. And that it will be done when the youth-led civil society organizations will have monitoring and evaluation. They are doing reporting. They are interested. They are engaged in different roles, and different civil society organizations are championing different things from what we have found out. I do not want to preempt what my colleagues are going to present. But this is our research journey. It's divided into 4, starting with political economic analysis, and then the sectors of the economy, capacity building, research, the research methodology, and then the dissemination. So at the heart of our research was the COVID vertically integrated social accountability and advocacy framework. It is the one that has guided us to collect this data. First of all, the data on the situational analysis during the baseline. Then secondly, this socioeconomic impact of COVID-19, because when as I mentioned earlier, the first research, we were looking at the responses of the governments. The second one we are looking at now, that response had socioeconomic impacts. And while at it, did the youth question their governments? Did they hold their governments accountable? And to do this, this is a context-specific, multi-level framework that is bottom-up, top-down. It aims at building early warning and response mechanism framework. It is we will use it as an advocacy tool to IGAD member states so that they can provide oversight, so that we can have a synergy between the civil society organizations and the government in providing oversight on public policy. Next, Alim. This is our framework that we developed. At the base, the very base of it, it has the PEA, then the governance, the sectors of the economy, and next to them are the local government, then the national government, regional and transnational. We all know that when COVID hit, we had the top-down approach, whereby we had the transnational government or the globe, World Health Organization giving the standard operating procedures and guidelines on what all governments should do. And then that was taken up by the regional governments like IGAD, called in the ministers of finance, and later on they formed a task force, which was also adopted by the national member states. They also had their own task forces, which they formed at the national level. Now, at the national level, all this information that was coming from World Health Organization, the national government, through their president or the national task force, was disseminating that information on protocols and what should be done. All the monies, all the resources were coming to the national government, and the national government was disseminating them. Now, our question is, on one hand, we have the service providers. As you can see on your screens, on one hand, we have the service providers, who are the government decision makers, or we have bilateral partners to our governments who also came in and also gave some resources or finance to the communities. They provided them to the service providers. At the bottom of the pyramid, we have the citizens in their communities. Now, these citizens at the communities are represented by our youth, because youth are the agents of change. Now, these youth, did they question the way, first of all, how did the youth participate? Those were the questions we were asking. How did the youth participate in this whole exercise? How are they engaged? How are they involved? To what extent? And they question, was there answerability? Was responsiveness? Was the when they asked questions, did the service providers answer them? That is the responsiveness. Did they get feedback from the service providers? And did they ensure that the government is enforcing the laws and following up? But before they do this, do they have the capacity? Do they have the capacity to information? Do they know even their mandates, their rights, their responsibilities and entitlements? Are they organized? Because most of the youth had, most of these youth are different voices at different levels. Youth are not a homogeneous group. Who articulated or who is articulating their issues? So we are interested. We went out to find out who was articulating your interests, who was projecting your voice so that you can now engage the government or the decision makers. This is what has, this framework is what has guided our study. Now, the strategy is just to strengthen social cohesion of communities by promoting human dignity and integrity and transforming societies for sustainable development. The transparency and oversight need to be improved through access to budget information, demanding for social services by youth, mobilizing and articulating their voices, presenting their grievances to the decision makers or service providers, waiting for local government to be responsive, and providing feedback on the performance. Now, to do this, the youth-led CSOs are supposed to identify, first of all, they should identify the responsible service providers so that they can hold them accountable and ask them to be answerable to the youth. If this is not done, then that is what is leading to the situations that we are faced with in most of the countries. So this is what the Pentagon went out to do. We went out to support the marginalized, who are youth in this particular case, and the vulnerable communities, and we have gone out to support them. This project aims at supporting them and empowering them so that they can be able to engage the service providers in public matters of public policy. The expected outcomes are to influence the process of public policy, monitoring and reporting national government budgets sent to the local government. And this will be dependent on the political economy analysis by the youth-led CSOs. Secondly, to improve their capacity, both of the civil societies and also the local governments, so that they can have meaningful youth engagement in social accountability. And thirdly, to strengthen the synergy between state and civil society interactions for meaningful engagement in social accountability and institutionalize it. This will bridge the divide between the excluded youth and their governments, and coordinate responses using data-driven, evidence-based approach. It will also improve governance mechanisms when we have meaningful youth engagement in social accountability and advocacy. It will strengthen partnerships, leading to more inclusive, socially cohesive society that recognizes and empowers youth as leaders and partners in transformational social change and good governance. Finally, it will enhance engagement of youth in performance monitoring and providing feedback that will lead to responsive allocation of resources to fight COVID-19. I want to finalize. We are using different tools to share our work, and this you can find it on our website. You will find this on the Austria website. I think this is my last slide. Thank you very much for listening to me.
Yes, thank you. Thank you so much, Dr. Trofena, for your presentation. I'm sure now participants are now very much aware of the project, including this socio-economic impact research study. Your presentation has nicely prepared us to the session where we'll be listening the details of the research on socio-economic impact of COVID-19 among the youth and the findings in the three countries. Thank you so much, Dr. Trofena. Having said that, I'm now taking you to our first presenter of the findings of the socio-economic impact of COVID-19 among the youth in Uganda. Professor Jude Sesembwa is a country research lead of the research study in Uganda. Along with him, we have Dr. Jerome Tege. He's also the male in the Ugandan team, and they will be presenting the findings of the study in Uganda. Over to you, Prof. Let me share your presentation. On.
Mr. Lim, actually, Dr. Jerome hand is up. Dr. Jerome may have something to say before we start.
No. It was a mistake. Sorry.
It was yeah. I thought so. Okay. Let me share screen. Where is it? Sorry, give me a moment. Yeah, it's coming. Can you see it? Can you see?
Yes, I can see. Others can see. Well,
okay, Prof. Over to you then.
First of all, thank you very much, Mr. Lemo. I always appreciate your support. You are very handy and you make our work a lot more bearable. I would like to thank Dr. Trofena for her very insightful presentation. Ours is a complex project, but every time you speak, Dr. Trofena, you increase my own clarity, and that helps our work a very big deal. I will also take a moment to send you greetings from Makerere University. A couple of years older than Austria, we are celebrating 100 years this year, the year in which we are implementing this project, for which we are very happy. And to remind all of you that as we celebrate 100 years, we are implementing a number of development projects, and we welcome donations, especially from such powerful organizations like Austria. Having said that, I would like to thank the entire COYOQA project team for the support they rendered in this chapter of the project, investigating the impact of COVID on young people in Uganda. Your coming strengthens our team always. And as we say in Uganda, the dominant language here, tusima bwongerwa, meaning that we thank you and we ask for more of your support. Ronald, welcome. I greeted you in the chat, but I think the message went to the panelists instead. I don't know what happened to Mr. Kayinga. He will join us in due course, but I will be presenting jointly with Dr. Ntege for a reason. I will now start. We will talk about a successful COVID-19 response that failed. and that is in the context of the socio-economic impact of the pandemic and responses to it on young people in Uganda. As the COYOQA project team will recall, I had difficulties buying into the idea of investigating the impact of COVID when I saw it unfold before my eyes, when I saw young people being locked down, their rights being abused. And now in the second year since COVID was declared a pandemic by the WHO, one may wonder what's left for us to talk about its impact that we already don't know. But the more I listened to Dr. Trufena and the rest of the members on the team, the more I reflected and read around the subject, I found 8 reasons why it is still important to talk about the impact of COVID-19, especially on young people, and then ultimately that there are lessons we can derive from that kind of discussion for improving the effectiveness of responses that will come to emergencies that will unfold in the future. Indeed, that being the case, our presentation is divided into 3 major parts. The first, and which I am dealing with right now, is the why part of investigating this impact. Then the next will be how we investigated the impact and what we found. When that has been done, we will reflect on the lessons that we draw from what happened to the youth, how they were impacted, and then the way we found the responses they are trying to make towards the way they were impacted. I'll talk about the why component of it. Dr. Ntege will explain how we did the study and what we found out. Then in about 5 to 10 minutes at the end, I will return to talk about the lessons that we draw from this pandemic, responses to it, for the better performance of responses to future emergencies. 8 reasons why it is still important to talk about impact, even if in the second year of the pandemic. Number 1, the impact of COVID was manifesting before our eyes, but there are intricate parts of its impact that were not reported in the media and which skipped the ordinary eye. Secondly, the effects of COVID, the way we saw them, happened in a ripple effect, causing other effects in turn, and those effects causing other effects, expanding vulnerability and presenting implications for future responses. Thirdly, a lot of the writing on COVID, even if it is enormous, is actually anecdotal. People talking about the impact of COVID and leaving it at that. In the present study, we attempt to go systematic, to get deeper, and thanks to a committed data collection team and as a big supporting team at the center in Addis, we collected a very diverse, very rich data set. So the lessons that we draw out of it are really very helpful. Having said that, we reflect on 3 questions, and it is to these that we sought answers. How did COVID-19 affect the social and economic lives of youth and their communities? Why did COVID-19 affect the youth and their communities in the ways that it did? Now, this second question tries to respond to an important gap. A lot of people talk about what happened, the impact that COVID caused, but without delving into why that impact was caused, why it was inevitable. And after we know what happened and why it happened, the third question focuses on what we learned that we will use in the case of future responses. But before even those responses, what we learned that we should use in promoting recovery from the pandemic. The next sections of our presentation, 2 of them, will explain how we went about answering these questions. Those are the methods and what we found. Dr. Jerome will take over from me at this stage, and when he has presented what we found, I will return with the lessons that we draw out of what we found. Thank you for now. Dr. Jerome, over to you.
Thank you so much. I hope the host will allow my video to go on, or I will just speak. Do you hear me now?
Yes,
hello.
We can hear you. We can hear you.
That's good.
Continue, please.
Yes, the research was done, the similar methods were used across. It was a mixed methodology methods, so we used both qualitative and quantitative, and we had to do some in-depth data correction, especially among the key stakeholders and government leaders and people that are leading NGOs, specifically that deal with the youth and those that address the social lives of people. And then we also, part of it was participatory action research, in a way that while we went to talk to people, we also listened to them, and we end up advising some people how to go around their lifestyle, because some people were desperate to speak. They faced some challenges during the lockdown. And the other part was also to working with the local civil societies. They were really energized to find a space to air their views on what was taking place. So we had the key format interviews, we had focus group discussions, and in Uganda, we had three major areas. We had the capital city, that is Kampala, and within Kampala, we looked for areas that are within the urban congested areas, like the slums, but also the areas that aren't so much congested, and then the areas that are in the periphery of the city. And then we also went in a little bit rural, semi-rural kind of urban area, which was in Masaka, Greater Masaka. And Greater Masaka had a purpose for going there. Was it has a lake side, it had a cattle pastoristic side, and farmers, and as well as small traders. So you had views from the lake and fishermen, then we had views from the pastorists. The areas of Sembabule were basically picked for pastoristic reasons, and then we had all these areas of Greater Masaka, which is farmer-based area, and then we also had to have people in the urban centers within Masaka city. So we had Masaka rural and Masaka city, and then we proceeded to Gulu. Gulu is in northern part of Uganda. It is an area which had suffered the atrocities of Kony, where many people they lived in IDP camps for a long time. Now they had started their settled life, and also the city of Gulu had is becoming a big capital center for people from Southern Sudan and Northern region. So Gulu, we had to pick within the center of Gulu town, but also we had to go to the rural parts of Gulu area. So it was Gulu, not Gulu city as such, but also Gulu city and Gulu rural part of the city. And this allowed us to have a world view, a bigger view of what took place within the urban centers, and also what took place within the rural areas, and also understanding those that were living in IDP camps, and those who are living as fishermen, and those that were living as farmers, to have all their views, given the fact that COVID had infected them differently. Now, when we gathered data, we had to synthesize and come up with both a qualitative data and also the quantitative, and we are merging these data together. It's a huge amount of data. I don't want to go into the sample size and the rest. These, we can read the report. We shall be able to have all the sample size that we did and the details if somebody is interested. Now, having said that, I want to go to the next slide. What were the findings? What did we come up with? Remo, can you go to the next slide, please? Thank you. Now, we are looking at the impact of the youth, the impact of COVID on the youth, specifically looking at 10 main areas of the impact we're talking about here. We are looking at this vis-a-vis what the government did. Like I said before, that when we are doing this research, we're looking at first from the desk research, what were the policies and what were the things government pronounced itself to do. Now we went in the communities to see how these were manifesting and taking place in those areas. So to start with was the issue of access to medical care. Now, interesting, the pandemic really affected access to health in a way that many people who do not lacked the money to access health, but most importantly, they lacked transport to the health. While there was a beef up of what can be done on health, but still many people couldn't have money to have access to buy the medications. Those who had the money, they couldn't even afford the transportation or to move from one area to another due to the restrictions which were put by the lockdown. So the main constraint was access, lack of money, but looking deeper in terms of what the lack of money also compounded with the predicament of lockdown. The private providers of health services were closer to participants, but then they were charging high fees, and so people could not afford. And I have some voices here. I will be reading some of the voices. Some community members, especially the local leaders, they said that the community programs of public health sensitization suffered. Public health sensitization suffered because we normally rely on community meetings together. Now, where community meetings were closed, they could not hold these meetings. They could not have meetings going. But also, we see that there were serious issues on limited access to sexual reproductive health, especially antenatal services. We have many of our people who were sick, could not access the reproductive health, and this later has another ripple effect whereby many girls and people became pregnant during this season. So part of their access to medical health was like the health took over all the money that people had saved. People had saved the money to buy food. Now they are using that money to take care of the sick people. But beyond just going to the hospital, the other challenge is that many doctors also could not even move to the hospital. While they were allowed to move, there were no transport means of moving from their home area to the hospital because the straining of transport. One doctor said, I live near the health center, but it was not easy for me to collect drugs because I could not walk to the center. Security people harassed me. So that was one of the key issues, was security harassing people that are going to access help. So the question then was, what did they do? We discovered that many people turned to herbs, to herbal medicine. One participant said that we depended on herbs for treatment. So we see this as a key issue that came up, that when people couldn't access medical facilities, they were using self-medication and also were using herbs. The other thing that we talk about is access to food. Access to food, we discovered that we discovered that during COVID, there was bound harvest. There was a lot of food, but still people lacked the ability to buy the food, and others could not even move to access food, still because of the restrictions that were taking place. So people lacked the money to buy the food, and others, there was an increase on the prices of the food because it couldn't move easily because of lack of transport. So while food was there in some areas, people grew a lot of food, there was a challenge in terms of transport to access the food, and also the prices had risen because of the lockdown. So now in the urban centers, people who depend on the casual earning, like those reminiscences of every day, access to food was really a big problem. Majority of these people live in urban city or same urban areas, and these ones, they could not buy the food, nowhere to buy the food. They couldn't access the markets, and when they tried to access the markets, they were the main safety was against the insecurity. The people were being beaten by the police. And then, so what did people do? We find urban people resorted to go to the villages. You find many urban dwellers now, they are going to the village to find ways of living in the village where people would access the gardens. Other people depended on government. There's some people who got money, food from government. Others were getting food from charitable organization. Now, urban dwellers who returned to the rural areas created pressure on the land resources there. We see that among the voices that come, we see that many people many people who came from the villages ended up now using up the little resources in the communities. So the food now became a problem. And then there were some business people who were giving food to government to distribute. And one business woman in Kampala said that many people gave to government, not only the rich, even the poor gave support to government to fight COVID. The spirit of giving, however, was affected by the corrupt government officials. So the donations that were given to people disappeared, and they were not properly distributed. So one of the key things we saw, people rising up, according to the people were rising up to the cause to support each other, but then there was no proper structures of distributing this food among people. I'll quickly go. The other part was the government came up with plans of giving food to people, but people were saying that there was a lot of politics in the COVID relief. You needed to be connected to somebody to receive people. This increased vulnerability. I'll move quickly to access to water and soap. Majority of the respondents surveyed, they said there was water and soap during the pandemic. The challenge was access to drinking water and soap. In terms of buying soap was hard because there was no money. And then also the people that came from the town areas ended up putting pressure on the little resources of water that were in the communities. So people lacked the money to pay the water bills, even though many reported here that the water was flowing, those who had the water, but those who were in the urban areas could not afford some to buy the soap to wash their hands and to take care of themselves. So for some youth, reduction in the availability of water, lockdown associated with the movement of people in urban to rural areas. When people moved from urban centers to rural areas, water sources suffered because due to over-increasing population of people who returned from urban areas. Distances to water sources increased for some communities. After certain water sources dried up, there was a lot of risk and danger along distant wells, including rapists and dwellers. So the challenge here on water basically was the pandemic. There was unintended benefit of improving hygiene. Many areas, people were washing their hands, people were not mixing up. So there was improve in hygiene because of the lockdown and also the telling people to be clean. So that was a positive part. Now, the other thing was access to energy. Majority of the people are still using the main grid, electric grid, as a source of energy. And we discovered that the majority of the people, while they were on the main grid, we also discovered that much of these people, the challenge was paying the bills, because electricity, you pay according to, it's called COYOQA. So one respondent says that paying bills was a challenge for the case of electricity. Some people stayed in dark. Another respondent said that the citizens had to forego some services like access to electricity during COVID and focus on how to get food, not light or darkness. So you see that electricity was there, but then people could not afford electricity. The other key impact was on transport. Restriction of movement and transport impacted greatly among the youth. Transport was closed. It was difficult for a poor person to access the hospital. Transport affected many things, and yet getting help from government was difficult. So people couldn't move, and that caused a lot of trouble. Even those who were moving were facing problem. One participant says that in Katwe, that some people even failed to transport their sick family members to the nearest hospital. So transport was a major issue. There is a lady who narrated her story. I think for me, it summarizes transport and health. She says, my sister was pregnant due for delivery. In order to move her to the hospital, we had to get permission from the local council chairman. When we failed to find him, we started moving to the hospital. Security people stopped us, beat us up, and we made it to the hospital. But after a lot of delay, my sister delivered but died. So this is a female participant within the focus group discussion in Chavakuza. So we see that access to health, while the hospitals were open, people could not move quickly. The other thing that I want to bring to your attention is income and livelihood. For many of the people, their income were halted. We see the majority of the people that deal in things like transport, like business in a hotel, food, those people really suffered a lot. They couldn't earn because their business not working. Then we see that other businesses kept going, like agriculture and some part of construction was taking place. Now, when we look deep into it, we see that some people in Kuangala, for example, said that I was selling milk. My business normally picks up after 7 p.m. During COVID, that was not possible. The following morning, milk would be sour, pertaining to a loss. So up to now, people have not recovered for the loss they felt. Another lady said that For them, they had to go and borrow money to a financial institution to get food. But now their property is being grabbed because they had to buy food. We see ladies, prostitutes. Prostitutes could not work, and then they have children. If you read our report, you find a lot of stories how they failed to sustain their home in that manner of earning when there was COVID, and now they are suffering the consequences. Now, the other thing that we look at is anxiety and family lifestyle and social skills. This was a major issue. As the lockdown continued, there was increased domestic violence within the communities. The stress and the lack of food, we tend to see that anxiety, stress, lack of food, lack of essentials, a number of these ones, they caused a cycle for strife. As we speak now, we have more problems that came out of COVID. Many people became single parents. Then the children became pregnant at an early stage. Life at home just changed. One person in the focus group said that life at home was not easy. We watched TV, we got tired. We visited families and friends, we got tired. Some youth under peer influence resorted to gambling, others dubious means to survive. Others said that family broke up due to lack of money. I had a friend and the wife left because getting food was very difficult. Up to now, we have never returned. So we see family life changed. But one of the interesting things that come out of this family life is the change of roles, which later comes when we talk about men started doing the work of women. Some men decided to help at home and do the normal work. Then some women also discovered that they can no longer depend on men anymore. So gender roles were altered. Men started to perform domestic tasks as cooking, washing dishes, and then women were now using the little businesses they had established to survive. But generally, we can say COVID-19 contributed the increase of gender-based violence, and this has continued to move on. Now, with my time being out of dock, I think we have very few minutes. I want to say one thing on governance, then I'll let Dr. take over. Before governance is environment. As people were relocating from urban to rural areas, unemployment, that increased, that affected the environment in a bigger way. We see many people started cutting trees. We see many of the swamps where now people are dealing with mining the sand, and increasingly many parts of the swamp areas became flooded with people because people are starting agriculture in the swamp areas. And people would say that when somebody looks at your tree and sees money because of charcoal, and every day has to plan how to cut down the tree. Now, after COVID, we are really going into a desert situation in many of these areas. And we have a lot of discussions and argument of how people landed on the sand and the brick making, that at the end of the day, the environment has been completely depleted, and also a lot of stress on the environment. The last part I wanted to say was the governance. Really, this governance, the biggest problem on governance was the human rights abuses. People could not move even to report those who had abused them. We had police brutalizing. The police and the local defense participated in trying to control the movement of people, but that really resulted into serious human rights abuses. Many of these abuses, some in terms to crack down the lockdown measures, end up making, as lockdown measures cleared, criminals in urban centers came back to the villages. And these criminals now were participating in looting, in stealing, in raping. Some made girls pregnant, and then later they disappear. I can't finish, our minutes are very few. I think I would love to stop there. Our report is huge to go through the voices and what we can do. But I would ask Professor Jude to take on from there. Thank you.
Dr. Ntege, thank you very much. I don't know whether Mr. Lemu has a facility for people to clap for you. I think they should.
Yeah, there is a facility down there.
Dr. Ntege said we followed a mixed methods approach, and that is very important in the sense that while the survey was conducted, it showed a lot of these impacts, the way the youth were impacted. But when we did the qualitative part of the work, the focus group discussions and the key informant interviews, it emerged why those impacts happened. And when we cross-referenced the impacts to the reasons that were identified for their happening, we realized that our data set makes a case for holistic, participatory approaches to emergencies. We expressed it diagrammatically as shown on the screen. Number one, government compartmentalized COVID-19. It was looked at as though it were a problem in isolation, when in fact, it was not the only problem. There were still other problems, medical, economic, and social, but they approached it as though it was isolated and as though it was the only problem. Secondly, they adopted a top-down approach, but people at the top can only see so much. There are realities on the grassroots that they may not resonate with unless they have been helped to see them. Thirdly, having isolated it as a problem and having approached it from the top downward, the approach tended to be high-handed, authoritarian, indeed securitized. The COVID response was a security response, but also that response looked into the campaigning period that was going on, in which the president's own power was being contested by a newly formed militant political group made up of youth called People Power and later National Unity Platform. The COVID lockdown restrictions tended to focus on clamping down at that descent. The outcome of that approach was high-handedness and then an imposition of lockdown that was with very few, if any, exceptions. That is why a pregnant mother seeking antenatal care, maternity care, would end up being beaten up and actually delivering, but dying on the way. Those cases were not isolated. In fact, if you asked President Museveni, who led the COVID campaign here, I think he would take pride and credit that the COVID response in Uganda succeeded. I think it did, because hospitalizations were few, the spread of the pandemic was contained for a long time, cases were few, and indeed deaths were few. The COVID response succeeded, but it could have done better. And that is why we are talking about these things. it is to be noted that that success in clamping down and containing the pandemic itself was at the expense of success in other areas. In other words, success in one area of responding to a pandemic can lead to failures in other areas, as indeed was seen to be the case that when lockdown was high-handedly imposed as a one-size-fits-all, people with HIV, people with pregnancies, people with diabetes, people with psychiatric issues needing ongoing medical attention suffered and died due to the lockdown, even if they were protected from the COVID itself. Because of the approach that was adopted, the safety nets that were imposed failed to work. Once the COVID relief food packages were politicized as shown under the approach component of this model, it became inevitable that the distribution of food was marred by corruption, patronage, where the people distributing gave to political supporters or to their relatives. And then, because of the securitization, because of the isolation of the COVID pandemic, and because of the top-down approach, the civil society organizations and other lay philanthropists were more or less blockaded from participating in the response, with the consequence being vulnerability as the socio-economic impact of the COVID-19 pandemic. We need to be precise in our wording. It is not the virus in itself, it is not COVID itself, but the response that was adopted towards it that brought about the impacts that Dr. Ntege talked about. I request to proceed to the next slide. In view of that, a lesson we draw for the future is that when we are responding to emergencies like COVID came, we should endeavor to be holistic. A problem occurring as an emergency should be seen as isolated, but also seen as part of our whole. Success should be conceived broadly so that we don't have a situation as we did in COVID, where people are safeguarded from death from COVID and then they die of HIV/AIDS, where people are safeguarded from dying of COVID and they die of hunger. That would be success narrowly defined and resulting into failure, which is why we talked about a COVID response that managed to stop COVID, but which killed people nevertheless. Secondly, responses to pandemics and other emergencies should be participatory. Victims, people at the grassroots, like the people we found in all these slum areas, semi-urban areas, lake fishing communities that we talked about, should be involved in the drafting of the responses. If they cannot be, as it might have been the case in COVID, at least their representatives should be involved. And then the civil society organizations should be allowed to operate, because these organizations actually present as the alternative government, which for many reasons are able to reach parts of the population that governments are sometimes unable to reach. Responses to emergencies should also be dynamic. It is understandable as to the limitations that were there in the COVID response initially. COVID came as an emergency. We were quite unprepared. But when gaps in the response went on manifesting themselves, the response should have been responsive. We shouldn't have continued clinging onto a securitized lockdown when it emerged that people were dying of hunger in their homes. It should have adjusted. The lesson for future responses is that when we start, we should evaluate continuously and review the approaches continuously. Finally, responses should pay attention to accountability. It should not be the case that governments take advantage of response emergency situations to gain political capital or mileage, to abuse people's rights, to swindle resources. Because when that happens, as we saw in the case of COVID here, people will rebel against the response itself. And then in an effort to clamp down on their rebellion, human rights are going to be abused and lives lost, when in fact, the whole effort is to save lives. We thank you very much for your attention.
Thank you so much. Indeed, we all need to clap for this wonderful presentation. Thank you so much, Prof. Jude and Dr. Jerome, for your excellent presentation. In my view, it has captured the study findings very, very well. I hope participants have learned about the impact of COVID-19 have specifically on the youth in Uganda. This has given us a lot of information, and thank you once again. If you have any questions, participants, and comments or feedbacks, please hold it, put it in the Q&A part of this the Zoom platform, and later on the Q&A session, the presenters and the research team will respond to them. Next, we'll hear from Professor Peter Barasa, who is a country research lead in Kenya. He's also a deputy principal academic research and student affairs at Ethiopia University in Kenya. He will give us the findings of the study in Kenya. Yes, over to you, Prof. Thank you.
Okay, thank you so much. Ladies and gentlemen, our ED and who is also the PI of this project, Dr. Trufena Mukuna, with colleagues in Austria who are the vanguards of this project, my colleagues, panelists from Uganda and Ethiopia. I'm not going to ask my colleague, Beth, to speak this time, but I will speak for both of us. If you can move to the next slide, kindly. I'm requesting that we spend some 30 seconds in silence in memory of the late Yvonne Mololo. Yvonne Mololo was our YOHEV. She was our point person and assisted us in collecting data in Mombasa. Unfortunately, as God wills, we lost her almost a week ago. And kindly, I'll ask you to spend a minute of silence in our honor. May her soul rest in eternal peace, and thank you so much, colleagues. Let's move on. Ladies and gentlemen, we were given an outline and asked to speak to things the way they have been outlined there. I may not necessarily follow that outline, but I must admit I tried to stick to the outline. If I was given the opportunity, I would probably have said something else in a different manner. But allow me to say this is the work of many persons, those who are point persons in Mombasa, point persons in Nairobi and in Busia. Can we move on, please? Yes, the ED, who is our PI, gave us a very elaborate interpretation of this project. And in doing so, gave us a very informative background to the issues of COVID-19 pandemic and the fact that it became a health crisis that created socio-economic predicaments to countries such as Kenya and among others in Africa. And my colleagues in Uganda have alluded to one particular thing that seemed to stand out as a social impact of COVID-19. And this had to do with the health care systems in African countries where we did not know how to manage the virus. And as new strands emerged, we seemed to have devastating challenges that we could not cope with. And that was not different in Kenya. It indeed exposed that though Kenya had some of the best medical facilities in East Africa, and probably on the continent of Africa, we required external interventions to keep ourselves going. Nonetheless, we must agree and acknowledge as part of this background that the government of Kenya, through presidential decrees, generated a stimulus fund to cushion its citizens and their businesses from adverse effects of COVID-19. So that in totality, if you look at it from the background, the activities that went on, there was an effort by the government of Kenya at that particular time when COVID emerged towards the end of 2020, moving into early 2021. There were efforts by the government to deal with this. But let's focus on the youth, because as you were told, this study is about the youth. And so the question would be, what was the role of the youth? And the youth in Kenya comprise a significant proportion of the population that has been greatly affected by the COVID-19 pandemic in many ways. And some of those ways my colleagues talked about: job losses and closure of businesses, rendering them unemployed. Please move on. So the youth in our case is defined by the Kenyan Constitution as any individual between 18 and 35 years age bracket. And I want you to keep that in mind, because when you're talking about socio-economic impact, these are the people at this stage who are producers and drivers of the economy. They may not be drivers of the policy, but 18 and 35 is when people are in their prime capacities to produce for the family, for themselves, and for the community. They form approximately 1/3 of the Kenyan population, and therefore a significant constituent that would need to be harnessed to improve a country. And when a pandemic comes and hits at this particular proportion of the population, you know what that happens. And indeed, we must argue that when they work well, this demographic part of our population can create the best in terms of us achieving our development. So the youth really need to be empowered appropriately and allowed to participate in the transformation of the country by the government. But then what happened? How did the government handle this to create an enabling environment? Because the pandemic changed all this. Now, in our study, I'm taking a little more, shall we say, a philosophical perspective that the opportunities exist for Kenya to adopt best practices of youth engagement, also to generate tailor-made home solutions on the question of youth factory. And I'm saying this because when we look at the three countries, we may wish to talk about youth as a block. But if you look at the idea of factoring in a supportive gender-specific approach to address vulnerability, first by male and female, you may find commonalities among the issues affecting men. I mean, female, but the issues affecting male seem to be, yeah, you may find commonalities about the issues affecting female because of issues of gender-based violence, issues of being maltreated within the economic setup of the country, issues of lack of opportunities to work, while the male, there's a common element here where everything is for them. So the answer to the COVID-19 and youth question in Kenya can be found in the youth participation in the governance opportunities, either individually or in self-organized forms that is legally recognized. And we came across so many CBOs, CSOs, and groups of youth, both at the county government level and the national level. And during the pandemic, they played a very critical role in alleviating the challenges the youth faced socioeconomically. Please, let's carry on. Despite the likely benefits of youth participation in governance and their presence, the presence of guidelines, on how they should participate, during the COVID-19 pandemic, the youth were left on the periphery of governance decision-making. And because of that reason, the negative socioeconomic impact of COVID-19 has made the youth vulnerable to manipulation by their perpetrators or by perpetrators of violence, such as politicians, and is easy prey for recruitment into violent extremism, crime, and terrorism. And all they are doing at that particular time was with the hope of gaining some pegs for survival. But our duty through this project is to see that there is capacity building for the youth to make them appreciate that they can be reliable agents of peace in their communities. And we had a very exciting experience in Nairobi when we went to Mukuru. Was it Kwa Ruben or Njenga? I can't remember. Yeah, it was, I think, Mukuru Kwa Njenga. And we found the youth organized in such a manner that they even said they take to task their colleagues who get involved in gender-based violence. And this was a product of the COVID-19 situation. Can we move on, please? Okay, please. Are you able to move the slide? Yes, the objectives of this study and its impact in socioeconomic terms was well explained by our PI. And indeed, for me, I'll concentrate a lot on trying to speak to gender, the socioeconomic impact of COVID-19 pandemic on Kenyan youth and their livelihoods. I may be able to touch on issues of governance as I go along. And so, karibu to what I'm going to present after that. I know for sure that you people have already seen this from our PI, that this was a mixed method research design. And for us, our areas were Mombasa, Nairobi, and Busia counties. Mombasa is at the coast. Nairobi is our city capital and the capital of East Africa. I know you not like that, but I cannot, I don't mind being proud of Nairobi being the capital of East Africa. And then Busia is a border county. And so Busia would be equivalent to probably Gulu, which is at the border of northern Uganda and Sudan. And of course, Nairobi would be equivalent to Kampala, and Mombasa would have been probably what? You have a sea, you don't. So that was ours. So our target population were youths mainly, but alongside the youths were opinion leaders, the local administration, political representatives, and leaders of various civil society organizations. Maybe I need to say a little about this. During the COVID pandemic, some of the youth became opinion leaders in the approaches they took to counter and to create a voice for themselves so that they could help their communities deal with the socio-economic challenges they had. And indeed, some politicians and local administrators were the conduits through which any support or interventions from elsewhere was received by the communities. And so it was necessary then to ask these people to speak to them and find out their roles and how they saw what unveiled during the COVID-19 pandemic. And then, of course, we must acknowledge the work of civil society organizations. In Kenya, these groups did a fantastic job. Right from, as you will see, preparing and manufacturing items like sanitizers to protect people, for them to keep themselves and their hands clean, manufacturing soaps and distributing them to other people, and even sourcing support from other organizations to intervene and provide masks and what have you. So the sampling technique was purposive for the qualitative data because we needed to go to the people who had the information. And then random sampling was used for the QAN or quantitative data. Our study engaged 735 respondents, and we used questionnaires and interview schedules. And of course, interview schedules helped us to interview key informant persons, but we also had focused group discussions. The data collection team comprised of enumerators and their supervisor in each town, and they also did a great job in sorting out who would be our key informant in some cases. Research assistants distributed and oversaw questionnaire completion, and the Austria Monitoring Evaluation Coordinator, Alemu, provided the technical administration and logistic support during the data collection process. And I must acknowledge the role of my colleague, Beth Amanda Maloba, in this. She was very active with those who were collecting the data on the ground. The response rate of our study was 97%. We had a total of 394 male and 341 female respondents who were interviewed from the 3 countries of Kenya, namely Busia, Mombasa, and Nairobi. And the study was conducted by undertaking household surveys using Survey CTO, which is a program that helped us to be able to collect data and store it. And it was quickly sent logistically to Mr. Lemo, who was collecting the data on behalf of all of us. Then we conducted key informant interviews and focused group discussions. I want to say a little about the next bullet by saying that 9.3% of the respondents had completed secondary school and 16.7% had completed or had a bachelor's or a master's degree education level, and 12.4% had attained diplomas and certificates from private institutions. What I'm speaking to is that we are talking to a group of respondents who were able to digest the issues that we were talking about, the issues that this study raised, so that there was no challenge of trying to say, do you understand? You may ask the question, then did you reach the common person? And the answer is yes. Like in Busia, in Mombasa, in Nairobi, we had a women's group. But good enough, these women also had gone to school to a certain level. They had certificates, and they knew the role they were playing, and they could articulate this. And so the kind of data we got was data that we didn't have to interpret and give our own perspective. They were the issues they understood, and they shared with us their understanding of the issues we raised. Please carry on. So data was coded into categories under the following categories. My colleagues talked about this: governance, socioeconomic impact, peace and security, environment, social well-being, and emerging issues. Now, when I was doing and we were doing this report with Beth, our concern was to try and avoid what we discussed and talked about when we did the initial study in the first report we gave, when we did the baseline study, because all these issues emerged from there. And we thought we should focus on the socioeconomic impact. And our brothers from Uganda have done a good job. They laid out what they thought impacted the society and the economy, as it were. But I also acknowledge what they have raised, that it was not possible to talk about socioeconomic impact without realizing that these are intertwined with the issues of governance, issues of peace and security within the community, issues of keeping the environment clean, especially at the time of socioeconomic, of COVID-19, and also the issues of ensuring that mothers have, and young girls were in a society that cared about their social well-being. And there are so many emerging issues. So all these may be intertwined in what we are talking about, and I may not pick out the issues as my colleagues said. Now, I thought I should bring this up front. What is the gendered socio-economic impact of COVID-19 on Kenyan youth livelihoods? And one would expect to see me speak of, for the female, this is what happens, and for the male, this is what happened, and we can speak out the role of women during that time and the role of men during that time. Hopefully, we'll be able to look at this. But I just want to appreciate that both the male and female youth were able to play a role in buying basic food items and medicine to assist the families survive. They played a role as young men and women to keep the families survive within very hard and harsh conditions. But access to medical services by their households was a challenge. And this is cannot be overemphasized, because Ntege did explain that yes, the hospital may have been there, but getting to the hospital was a challenge. Or the hospital could have been there, but the hospital may not have had the kind of facilities required to survive an attack of COVID-19 at that time. When people became ill, it became difficult for them to access gas cylinders to be able to survive and have an opportunity to breathe. And some of them were quarantined, and it was, if you may say, nobody wanted to get near you. It was leprosy, in other words. Not to say that a leper is not human, but the kind of behavior people did with leprosy before we knew what it was and knew how to treat it, right from the Bible. That's what was happening with COVID-19. The youth still needed to use public transport during the COVID-19 crisis to work if they had work left and to address personal issues. And they were able successfully to access some public transport. Unlike our sisters, maybe, and brothers, wherever they are, in Kenya at one point, there was what you may call lockdown. But lockdown was zoned. It was zoned. There was a time it was over the whole country, but it was zoned so that you could have other areas who are in one place moving. Like people in Nairobi would be tied to Nairobi and other areas around there. Then Nakuru, Naivasha, Eldoret would be allowed to move. So somehow that was possible. And most household livelihoods depend on wage employment, and most youths are engaged in buying and selling businesses, hotels especially, and restaurants. And as COVID ravaged businesses, the negative impacts arose because the businesses closed down. And as the government instituted measures to curb the spread of the disease, such as lockdowns and curfews, life tightened. And in tightening, we begin to see where the question of the socio-economic impact was. And I think our PI talked about the first bit where those who lived in poverty, their lives became terrible. And the precautionary measures have continued to have a negative socio-economic effect on workers and businesses to date. There are some businesses that have never opened. There are others that have had to change their approach to doing business, but most of them have not gotten back the numbers. Speaking to the nation on Labor Day, the President of the Republic of Kenya, Uhuru Kenyatta, did observe that unlike in private organizations that lost businesses, small and medium enterprises that lost businesses, the public sector did not lost jobs. The public sector did not sack anybody. And it's true, teachers stayed at home and under salary, and it was not half salary. Those who were in public schools, private schools, indeed lost their jobs. But within the government, they didn't lose their jobs. The youth experienced a far greater impact in the long term as the labor force and business entities continue to grapple with the novel disease. Lockdowns, curfew have reduced the revenue streams for the youth in business. And this has led to eventual closures of youth ventures and generated challenges of meeting their basic needs such as food, house rent, and this is according to the National Cohesion and Integration Commission of Kenya in the year 2020. Now, I put this figure here, which I hope you may be able to see. I'm not sure if you have a laptop, you should be able to see. I just wanted to show you the measures that the youth, both male and female, used to reduce the risk of contracting COVID-19. You'll notice that there's a lot of attention on hand washing for both male and female. And you cannot say that the male had more, because it's virtually, if you look across in Mombasa, the female did a lot more on enhancing the community to do hand washing. And they saw hand washing as an opportunity to reduce. In Nairobi, it is almost at par, you see? So that when you look at it, at the end of the day, 87, 86, both male and female were conscious about the role of hand washing. They were also conscious equally of the use of masks. They were conscious of the value of maintaining social distance. But these other issues of using gloves, avoiding to travel, staying at home unless necessary, maybe a bit of avoiding crowded places, and then handshake and physical greetings. People can safely say both male and female contributed in making people aware of the measures necessary to reduce the risk of contracting COVID. And therefore they played a role in improving and reducing the socio-economic impact of COVID on people. Let's move on, please. So access to basic needs. Our female respondents interviewed in the counties, specifically Busia and Mombasa, decried the challenges they faced to feed their families. There are so many voices, I couldn't fit them here. Some of them, if they told you the stories they had to do, included at times getting into relationships with other men, and they brought food home, and the husbands wouldn't dare to ask where the food came from. And if they did, they told them a friend had given them food. So there was need to feed families. And you can see the impact of this on women, interfering with what could be, if you want to call it, the moral issues within their relationships within the family. With their husbands losing employment, the women took up activities that made them breadwinners in the family. So small-scale trading continued in a way to make the family survive. You can extrapolate this in the process and see how this affected people. Now, on issues of food insecurity, our question was, are you able to buy food? And when you see the green, the blue is male, the green is female. In Mombasa, you can see more women said they had the ability to purchase basic food items. The men almost gave up on buying food items because they had no jobs. So the impact was greater on them, and their wives took up. In Busia, it appears to be almost at par. In Nairobi, few women, being a city, I suppose, are not having the capacity to do certain activities like farm from the small farming kitchen, what do you call it? Farming within the compound and so on, and getting food for the family. You see, the men still had to look for food and the women were not. When we asked people in Mombasa, those who said no, they were not able to buy basic items of food. Again, you see the women are up there about 30-something to the 50%, and the men. So if you look across, you'll see ability to purchase medicine. The women, again, in Busia, is the purchasing of medicine. In Mombasa, again, it is the women. In Nairobi, it is more of the men. Engagement in income generating activities, look at Mombasa. The women are up there. In Busia, the women are up there. To say, no, they did not get engaged, the women did. But here, yes, in Busia, the men were engaged in generating activities. And I can tell you this, a bit of trade across the border, even if it was closed, this went on. Please move on. So ability to purchase basic foods has been laid out. I've discussed that. And so both gender agreed that they could not buy basic food items, about 41%, while 58.2% disagreed and said they can buy food items they could not buy. So please move on. Now, the issue of medicine has been talked about. You are aware that when we had our first victim of COVID-19, it was a national activity. It was national news. And in doing that, it meant that, as it were, many families suffered. And it is clearly indicated that 51% male agreed that they were not able to buy medicine, while 49% women said they could buy medicine. Let's move on. I don't have much time, I'm told. COVID led to loss of employment among youth in Busia, Mombasa, and Nairobi. Move on, please. I've spoken to that. Now, gender-wise, Mombasa County registered a high percentage of women not get engaged, and I've spoken to this. Busia County had the highest percentage of respondents getting engaged. And then the male respondents not engaged in income generating activities, Mombasa, Nairobi, may have been contributed to due to layoffs and business closures. Please move on. Aspects of social well-being, I've spoken to this already. Medical service, household access to medical services. So let's go to government response. How did the government respond to the pandemic, and how did it impact the socio-economic lives of Kenyans? The government used existing administrative structures, that is government ministries like the Ministry of Health, the Ministry of ICT, the Ministry of Information, the Ministry of Devolution. All these ministries are used to distribute food. County governments and county commissioners to govern and manage the pandemic, and also to keep peace and keep people at home. They generated a stimulus fund to cushion its citizens and their businesses from adverse effects of the COVID-19. Please move on. I have quite a bit on government response. Keep moving. Now, on food security in some parts of Busia County, this is what Amanyala lady said, it was evident and during that time that we had serious floods in Bunyala and made people to relocate as things were destroyed completely, which means in addition to COVID, there were other issues to do with the environment that made people's lives difficult. The government allocated funds to cushion the youth and their businesses. The challenge was twofold. Either the youths were not aware, so they could not access the funds, or if they were aware, its disbursement was erratic. And somebody says that what happens that they were called at a forum and given 100 shillings. Yet the truth of the matter is the money was between 2,000 and 4,000. Move on, please. In Kibra, Nairobi, one of the informants says, for me here in Kibra, I did not see any kind of fund, as everyone used to have their problems. So everybody solved their own problem. A youth in Mombasa said, it's the first time I'm hearing about it. Carry on. So the funds were there. The government created a job opportunity for the youth called Kazi Mtaani, working in the estates within the cities, within the towns. In the Busia counties, the youth were many and were allowed to work in town, in turns. The member of the county assembly said, but at times the money was not remitted on time and took time for the money to be received by the youth. Please move on. In Nyali, Mombasa, the initiative was referred to as Kazi kwa Vijana, jobs for the youth. And it helped this youth get alternative means of livelihood. And he further noted that there was cash transfer programs from the national government, from the World Food Program and SHOFCO, which helped the youth even through the process. Though the process was opaque, they had some money to feed them. Carry on. Through the National ICT and COVID Pandemic Committee, the young people were able to earn a living from the gig economy, like courier deliveries of food and products, and the county government of Mombasa instituted a gender-based program that involved training the healthcare workers on forensic management of gender-based violence and the preventive measures. So I'm saying yes, COVID had a socio-economic impact, which was GBV, but the government and other organizations at devolved levels and national level and interventions from other communities helped us to do that. So in Mombasa, tourism is an important sector. And when tourism went down, there were efforts to revive it. So the tourism sector led an advocacy that saw the government release a kitty to the tune of 3 billion, which ended up to be used in hotel refurbishment instead of cushioning the youth. And this is according to the key interview format that we talked to. I think I've spoken a lot about this. I just want to say that there was a government transfer of 4,000 shillings. So let me talk about the conclusion. COVID-19 gave us a new approach by our CBOs and CSOs. They initiated and mobilized the youth in mask, sanitizer, and food distribution. Some of them were involved in constructions of water tanks and ensuring water could be taken home to limit interactions of community members so that the risks of COVID could be reduced. Some organizations trained women in making soap, keeping their families and communities clean. Carry on. Please go on, I just want to finish. What I would like to say in total is that there were social media platforms for sharing information on COVID-19 spread, mitigation, and issues of budgetary allocation by central and county governments. They also used the youth to educate, the platforms to educate the youth on the budget formulations, like the case of the KCDF in Busia County, so that people knew about budget formulation and how their governments were preparing budgets and how they could spend part of the thing on COVID-19. They set up programs to handle extreme violence associated with the loss of jobs and stress. And indeed, if you look at Mombasa and Nairobi, there was a lot of this. Carry on, please. Some of the CSOs mobilize financial resources and they disperse this to the elderly community. And they also use the money to purchase food. And they worked with the Red Cross and so on to carry food to the elderly and to homes that didn't have anything. Please move on. There are cases where CBOs helped in listing border riders to help them move sick people during curfew hours so that they could be a group of border-borders. Border-borders are motorbike riders so that the security apparatus would not harass them. And this minimized fatalities during that time. Now, this section speaks to what the government of Kenya should do differently as the country recovers from COVID-19. Please move. Next. The first thing is that the government should try and demonstrate fairness to all citizens in providing health care related to COVID and any other crisis in future. There was a lot of imbalance in who got support from the government. Next. The youths are heterogeneous, as stated by one key youth informant. Therefore, identification and categorization of youth will make it easy to understand their unique needs and how they can actually have their needs addressed because their jobs are still not what they had before. So lumping them together leads to missing out uniqueness. There are others who are people living with disabilities. There are people who have talent, and they can be used during such a pandemic to improve on service delivery to the society. Capacity building should target all youth or youth of all gender, especially in governance issues, to equip them with skills and knowledge to meaningfully deal with issues at central and developed government levels. So both youth-led CSOs and government officials need soft skills to strengthen state CSO interaction for proper social accountability. And this can be done through seminars, workshops managed by CSOs in partnership with government, NGOs, Austria one of them, and other institutions like UNESCO, World Bank, among others. Am I not through yet, please? So funding of SEO by government would go a long way to help grassroots youth engagement. And therefore, CSO government-funded forums are more ideal to empower youth of all gender. Mainstreaming gender intersectionality for equity to avoid anti-discriminatory policies into emergency recovery responses. Women kept families afloat, yet they were at the tail end of the decision-making process. Women made a statement. Thank you.
Thank you, Prof. Barasa, for your excellent presentation. I hope participants have got the highlights of the impact of COVID-19 among the youth in Kenya. So if you have any questions, please put it under the Q&A and comment section, and later on, if we have time, we'll respond to them. Now I take you to, because we are running out of time, I will take you to our next speaker, who is Malcolm Srabarra, who is the country research lead for Ethiopia in collaboration with Dr. Nugusu Lagasa. Malcolm is a program lead at CCRD, the Consortium for Christian Relief Development Association. He will give us the findings of the study in Ethiopia. Over to you, Malcolm.
Okay, thank you, Alamu.
Continue, please. You have 20 minutes. Sorry for that. Because we
Okay.
are running out of time.
Okay.
Yeah.
I will not focus much about on the background issues because it was raised by Dr. Trufena and my colleagues, Professor Jude, and so I will directly go to the finding part in Ethiopia, but to say some on the introduction part. The project is implemented by 5 organizations, and CCRDA is one implementing in Ethiopia. The overall goal of the project is to enhance youth engagement in social accountability and advocacy. So the purpose of this study is to have a better understanding on the impact of COVID, especially on the social and economic areas in the 3 regions. As we know, COVID has a serious impact, especially on health and economy. As of February, as you can see, as of February 2022, there were more than 450 million cases globally, 11 million cases in Africa, and 467,000 cases, and 7.4 thousand deaths in Ethiopia alone. That is huge number within this short period of time. In response to contain the epidemic, the pandemic, governments have implemented different measures, and most of them include partial or full closure of business and human movement. That is the main hypothesis for the socio-economic impact, the main cause. So this restriction severely affected the business and the social interactions worldwide, even though the impact differ from area to area, depending on our economic status, the strengths of the health system, the economy, but the impact is more visible, and it is even riskier in the developing countries. Ethiopia, as one of the developing countries, has felt the impact even in the early periods. So, like the rest of the world governments, the government of Ethiopia has implemented a state of emergency that have stayed for 6 months. The state of emergency has banned gatherings, halted operation of restaurants, movements, including international and local, and many other economic activities. The logic for the assumption for our study is the youth might have been affected more since they suffer from low quality employment, and even in Ethiopia annually more than 2 million new job need is created in Ethiopia. So the youth might have been affected more. That is the assumption for our study. So the general objective of the study was to assess the gender socio-economic impact in 3 regions of Ethiopia: Addis Ababa, Somali, and Sidama regions. Addis Ababa is the capital of Africa, as you know, and it's the 3 regions has their own socio-demographic characteristics. Addis Ababa is a metropolitan city. The Somali region is more of the main source of income is by cattle production and the not agricultural crop production, and Sidama region is mainly cash crop production area. So these 3 regions have their own socio-demographic differences, and we have assessed the 3 regions, the impact of COVID on these 3 regions, especially as it is indicated in the specific objective, the livelihood, access to different social services, including health, education, and others, the food security on the youth and their households, and support from the government. These were our main objectives. As methodology, we used a mixed approach, both quantitative and qualitative. The study period was from mid-October to early November. The study setting, as we have said, it was conducted in 3 regions. In this region, in each region, 3 areas were selected totally. There was 9 randomly selected areas, 3 per region. The study design and the study population was a community-based cross-sectional study was the study design. The study population was used from 15 to 35 years. For quantitative study, we selected users randomly, but our inclusion criteria was they should be permanent residents in the specific areas and they have to be volunteer to participate in the study. For qualitative, we selected key informants for in-depth interview, whom we thought might give additional insights or new local perspective. For FGDs, we identified users. The sample size for the study was calculated based on single population proportion formula, and 272 study participants were selected from each region totally. Our minimum sample size was 816 from all the 3 regions. Participants, especially for the quantitative, participants were selected using non-probability quota sampling. For qualitative, as I have said earlier, respondents were determined using principle of saturation. We have stopped when there was no new information coming. Okay. The data collection with the structured interview, administered questionnaire using SurveyCito software. With use data collectors using tablets with the software, the questionnaire were uploaded on the tablets, and the data collectors were moving from area to area to interview users. For qualitative, we used face-to-face, in-depth interview, and FGD. Data processing and analysis, logistic regression for analytical analysis, and for descriptive analysis, we used mean, frequency, percentages, and the result was displayed in different tables, diagrams, different methods. And for analysis, we used SPSS. For qualitative, thematic analysis was carried out. I'm a little in a hurry because I have only 20 minutes so that I may focus on the result part. Okay, so the result, totally 844 respondents were interviewed, that's 100%. For qualitative, we have conducted 25 key informants, 9 in Addis Ababa, 6 in Hawassa, and 9 in Jijiga. 9 focus group discussions were conducted in each region. Our focus group discussion was 1 for male, 1 for female, and 1 mixed group interview per region. That is totally 3 male groups, 3 female, and 3 mixed groups. I have divided the results into the qualitative and quantitative, but when I present, I try to provide the results from the both perspective. Our participants, as you can see, were almost equal, a little higher female, 51% and 49% male. When we see the age group, the characteristic of respondents by age, more than 3/4 of our respondents are under 30 years. The educational status of the respondents shows that 92%, majority of the respondents have some level of formal education, starting from primary to bachelor or higher. But most of our respondents are secondary complete. When we go to a specific socio-economic impact, we have asked respondents, we have assessed the knowledge of respondents regarding the spread of COVID-19. They were asked, respondents were asked if they know what measures can reduce the spread of COVID-19, and the use of mask and hand washing and use of sanitizers are the three most identified reduction measures, but others like avoiding handshakes and others have also mentioned. Okay, next. Steps taken by the government. The respondents were asked what the government has done, what steps have the government done to halt the spread of the COVID-19, and majority, 78% of them said that the government advised citizens to stay at home, then the schools and universities was closed, and then restriction of travel. These were the three major steps identified by the participants. Regarding source of information, where they heard about COVID, especially self-isolation, local distancing, and other relevant informations, 90%, generally 96% of them reported that they have information about COVID, but the main source of information was from television, followed by radio, and social media is still on the lead. It's about 45%. Okay, next, please. About 31% of the respondents have said that they were not satisfied by the government's response towards controlling COVID-19. And the main reason that they were not satisfied against the government response was there was no financial assistance from the government. And it was followed by shortage of medical materials. As you can see, the results are somewhat very related. Late response by the government is also mentioned as a reason for dissatisfaction. In addition, participants were asked their trust over local authorities regarding COVID response, whether the government was fair in treating the community or the population, government ability to provide health services, and their attitude towards following government guidelines. So it was a Likert scale. We have summarized the data as a mean. In most of these 4 areas, the participant response was neutral. They have rated neutral, except their attitude towards following government guidelines. So the overall mean score was they were neutral. Access, regarding access, the second category was access. In this category, we'll see access to medicine, transport, water, wash, and others. Access to medicine during the pandemic, about quarter of the respondents said that they were unable. As you can see on the right side of the bar chart, around 24% of the participants said that they were unable to access medicine. 62% said they didn't need. The rest 38% said they needed to have medical service, but 24% identified that they were not able to access. That is significant number, significant proportion. Ability to buy basic food items during the pandemic. We have interviewed participants on whether they have faced difficulty to buy basic food items. And as you can see, 35% of the respondents said that they were not able to buy basic food items. And among the 3 regions, Awasa, the Sidama region, has a higher proportion of respondents who said that they were not able to buy basic food items. If you can see in Addis Ababa, it was only 28%, 1/4, and it is in Jijiga or Somali region, it is about 15%. But in Hawassa, it was about 22%, more than about 2/3. And our partner from JECDO, Masrasha, I think he's attending the webinar, and he might add his perspective in the Q&A session. This is an interesting finding. Household reason not to be able to buy basic food items among those who said that they were not able to buy basic food items. The primary reason was increase in food price. And it is followed by closure of markets, run out of stock, and the like. But the main reason was increased in food price. Ability to buy staple food, non-basic food items, when we see their ability, totally 39% of respondents have said that they were unable to buy non-basic food items. This is also supported by our qualitative finding. We'll see in detail. In that, still in non-basic food items, the response from Hawassa, the finding from Hawassa is still higher when it is compared to the two regions, Addis Ababa and Jijiga. Hawassa still has a higher proportion. Okay, next. When we see the access to drinking water, totally almost half of the respondents said that they were not able to have sufficient drinking water. And when we see the limitation or the insufficiency in drinking water, it was higher for Jijiga. Regarding access to reason for unable to have sufficient drinking water, and unavailability, or the water was no longer available, was the main reason, or reduced in supply was also another reason. Sufficiency of water to wash hands. Totally, about 1/3 of the respondents says that there were no adequate water for hand washing. It was still higher in Jijiga. As we can see, 25% of respondents reported that they did not have sufficient soap for hand washing. The main reasons was related to price and running out of stock. Medical service, need for medical service. Totally about 40% of respondents, 35% of them has indicated that their households were not able to access medical services. That's about 1/3 of respondents wanted but did not access medical service. The main reason for that was lack of money, no medical person available. This is highly supported by our qualitative findings, and we'll see that in detail. When we come to income, one of our interesting finding was this: 55% of participants reported that they didn't do any work for pay, even that is for an hour work. Out of this, 39% had work before the pandemic, which means they were laid off due to the pandemic. More female respondents were affected by loss of job and lack of income. Higher proportion of respondents were female. The proportion of respondents was even higher for Jijiga, that's 71% compared to Addis Ababa and Hawassa. When we ran logistic regression, we have identified that those youth living in Addis Ababa have 4 times greater chance of having paid work than Jijiga. We have made Jijiga as a reference population, and even those in Hawassa have 1.8 times relative getting chance of job than Jijiga. Okay, we can go to the qualitative session. I think I have only 5 minutes. If you allow me some time, Alamu, I can go through the findings of the quantitative, but within the time I can't, I think I can finish it. Okay, the qualitative findings regarding good governance. Our finding reveals that the pandemic has severely affected the operation of many public institutions, especially the health and education sectors were highly affected. Regular public services were changed to work from home and working by rotation. That is, half of the staff will work today and will be off the next day. And like that, the process will continue like that. It has also created a good opportunity for poor governance and corruption. Several institutions reasoned COVID presented COVID as an excuse for not giving quality services. Okay, on their counterparts, they said that lack of personal protective equipment have hindered them to provide adequate services. They were not willing to provide services without having adequate personal protective equipment. Okay, next column. Regarding access to public health, almost other non-COVID services were collapsed because healthcare professionals were shifted to quarantine centers or COVID treatment centers. Sales professionals, sales institutions were shifted to temporary treatment centers. So other non-COVID, including reproductive and other basic health services, were totally collapsed during the pandemic. Education, regarding education, it is one of the extremely affected area, especially due to closure of school. Children were spending more time at home, so they were exposed for psychosocial problems like panic, anxiety, gender-based violence, substance use, addiction, and even in some areas, juvenile delinquencies. They were engaged in harmful criminal activities. School dropouts were increased because parents were not willing to send their, when school was reopened, parents were not willing to send their children to school because they fear they will bring COVID back to home. The quality of education was compromised because there was free promotion from grade to grade, and they were not able to cover the missing part, or they were not able to compensate, so quality was significantly affected. Next column, please. Public transport service was also severely affected. Participants indicate that they were forced to pay 2 to 3 times higher tariff, especially people with disability were highly affected because they need assistance, so they have to pay even that payment twice. Even those in the transport sector complained that they were forced to their restrictions, their occupancy level was restricted by half, so it affected both sides. Next, please. The economy, as I have said earlier, especially women have affected by the economy, job loss, lack of income, which is also associated with food insecurity, was high. Next column, please. We can pass this too. Okay, peace and security, another interesting finding was peace and security has dual effect. On one hand, the restriction and decreased social gatherings have positive impact, while on the other hand, joblessness has promoted theft, and it has its own negative impact on peace and security. On law enforcement actors, there was violation of human rights, freedom of movement. They were detentions without identifying, confirming COVID-19 status, and sending people to quarantine centers, and on environment, it has both positive and negative impact. It promoted home gardening, hygiene and personal hygiene and environmental sanitation, but on the negative side, improper management of hazardous wastes like mask and even some wastes from quarantine centers was not properly managed, so it negatively affected. On social well-being, this is another interesting finding. Girls and women were highly affected because they were caring for ill relatives. The burden of the household has increased on them, caring for the household, cooking and other stuff. Some social values and social support mechanisms like Uqub, Idr, and Bunna ceremonies, which are local social gathering methods, they were highly affected. And this has, for example, when people, the community can't bury the dead, especially unless its COVID status was confirmed. This has severe psychosocial and other impacts. We have tried to present the social well-being, especially related to GBV during the COVID pandemic. Due to school closure, people tend to stay home. There was home drinking and substance use has increased. As a result, GBV, from harassment to rape, has increased. Abduction, even in some areas, were seen. Early and unplanned marriage as a consequence from unwanted pregnancy or to cope up the economy due to other reasons. There was also an early and unplanned marriage. So this all leads to unwanted pregnancy and childhood pregnancy, teenage pregnancy. As a result, this in turn leads to unsafe abortion or increased morbidity and mortality from the complication of pregnancy, which also has its impact on economic status. As a conclusion, we have seen that the COVID has brought high level of socio-economic impact. The major areas are income, livelihood, food security, and access to basic services, especially education, health, and water. The pandemic, by adversely affecting many public institutions, created good opportunity for corruption and poor governance. The major cause for this was unavailability and unwillingness of service providers. Even though this vary among geography, gender, and other characteristics, the government NGOs did not make adequate support for the community. Our study also finds that the satisfaction of users to government's response was low. But the community has, especially the youth, has adequate knowledge about COVID transmission. Education sector, as we have said earlier, is extremely affected. This I have said. We can pass this. Next, please, Alam. The response measure against the pandemic has, on some areas, has both positive and negative effect. The pandemic has improved personal hygiene, environmental sanitation. Girls and women, besides sharing all the burdens that we have said earlier, they were particularly affected by increased household responsibilities and GBV. Next, please. In addition, the girls and women more affected by the pandemic than males in terms of access to paid work and economy, household economy. Our finding also supports that it agrees with other literatures that the restriction taken by the government to control the pandemic has severely disrupted the socio-economy of users, and overall, COVID pandemic has exacerbated existing inequalities along gender and socio-economic lines. Our recommendation is the government should address limitations affecting access and quality, design policies which mainly focus on improving job access and livelihood, and stimulate the economy. Should do something to stimulate the economy, at least to the pre-COVID level, to make it to the pre-COVID level, and regularly assess its policies and modify by engaging users starting from the policy design process. Civil societies need to design evidence-based and unique innovations that can be shared even to the government, that can be an eye-opening unique innovations. Integration of mainstreaming of COVID responses should not be left alone still. It should be integrated with other services. Either we should not be focused on COVID alone and reject other services and focused on other and forget COVID, but it should be integrated with other services, or generally all concerned bodies related to use should involve users at all stages. And that's all about. Sorry for the fast presentation. Thank you.
Thank you, Malcolm, sir, and I'm sorry for rushing you also. We are running very late. We have only 8 minutes, and we also have one more presentation. And we want to take also some questions. I can see that there are 3 questions in the Q&A. So I don't think we have enough time. Dr. Trufena, can you do it in 5 or 10 minutes? Or we skip your session for today and go to the Q&A section?
Alem.
Yeah.
Let's go to it.
Yeah.
Let's go upload my slides. I will just mention what they are about. I looked at everything that we have done as a team and thought at this particular moment, I want to speak to the issue of the gendered socio-economic impact of COVID on youth and social accountability by proposing a feminized approach, a feminized gender transformative approach to social accountability. What do I mean by this? Looking at all the, from what we have listened to, the beautiful presentations by my colleagues from Uganda, Kenya, and Ethiopia. And I am very grateful to you because you have captured exactly what we found out in the field. In fact, I'm going to request IDRC to allow us to have these reports as booklets, so that we have 3 books, and then now we have a synthesized booklet for the reports on the 3 countries for the IGAD region. Thank you very much, the presenters, and thank you for the time you've taken, and even those who contributed to this work. So, what I would like to emphasize here is the feminist gender transformative approach. The feminist gender transformative approach, why I'm thinking like that is because the socioeconomic impacts, the gender differentiation was exacerbated by COVID, and yet the policies that the government came up with, were not gender responsive. Instead, they were gender neutral. If we analyze this policy, all of them per country, we find that they were not specific about gender budgeting. They would just release funds and not disaggregate how that money will be spent. Alemu, kindly. Next slide. So this is you will see this on the website and look at it. I was just trying to summarize what this the COYOQA political economy analysis is, and then the sectors of the economy and what happened at every sector. What was the impact at every sector? This diagram summarizes all. It is not comprehensive. We shall revise it. We shall revise it when we get from the Q&A session or after we compile all the reports together. Next slide. This is the example of one of the sectors of the economy. If we look at the environment as a sector of the economy, you find that due to COVID-19, there was lack of food. This lack of food led to the need for, it led to poor health. The people needed school fees, which was lacking, harvesting of sand. They reacted at the village level. A lot of things started going on. The need for energy, the lockdown and idleness. It led to resource scarcity and lack of jobs, child labor, and all these things. They were happening at the village level. All these activities had an impact which has affected the environment. Like, for example, where we had the harvesting of sand, harvesting of, swamps in Uganda. We saw in Uganda the cutting of trees, and generally the destruction of biodiversity. The fresh water was also contaminated. Ozone layer will continue being depleted, and the livelihoods are destroyed. All these things that have happened will lead to climate change. So this is just one of the sectors, the socio-economic impacts that are related. They were caused by by COVID, but they have had an impact on the climate. Now, the way forward is we are proposing that the government may, the governments may meaningfully engage youth and focus on feminizing the policies. When we talk about feminization of policies, especially in the care economy, because we found that as we are moving toward, as we are recovering and building resilience to COVID-19, the policies should be, they should be gender responsive, and when they are gender responsive, they should be, we should feminize them so that they are transformative. What do I mean by this? If we do not have men supporting women to remove the gender stereotypes that we have in the society, then we will continue having these skewed patterns, these the challenges that we are having, and they are even being exacerbated by the problems that we are having with the Ukraine war, to add on adjusting to the responding to recovering from COVID-19. And I am proposing something here. I'm proposing a theory of change. Next slide, please. I'm proposing a theory of change. Next slide. I'm proposing a theory of change, the U-loop theory of change. In this theory of change, somebody's phone, please switch off your phone. In this theory of change, where we started, we had existing gender inequalities and social exclusion in community livelihoods. We have done research and we have revealed the underlying gender dynamics. The household surveys that we did, we have revealed the gender dynamics and patterns uncovering the roots of gender inequality and social exclusion in the communities where we have worked. Now, from the gaps that we have identified, we are proposing that the policymakers and the youth may unlearn. There should be value addition. We should have the values Ubuntu, the beliefs, the principles and social norms that we believe in, so that in our community of practice, whereby we have all the stakeholders that we identified in our community of practice, when we share this knowledge, like these reports that we have posted, when we share this knowledge, it is a turning point. It is a turning point, and where those who have resistance to bringing women on board, or the excluded groups like women, youth, the disabled, those who have self-doubt, may create space and an enabling environment and have an alliance that will be institutionalized in our governments, starting from the local level, the country level, and the up to the regional level. When this is done, we will see adoption of new methods and values, ideas, and belief systems because of capacity building. And already in this project, we have inbuilt capacity building so that we can empower both the youth and the leaders on issues of social accountability. When they get capacitated, when they get this technical capacity, and as they will be developing the new programs in future, or even as right now, as governments are grappling with the recovery strategy amidst this Ukraine war, the planning of the new situation will be very dynamic, as the researchers suggested. It will be very dynamic, it will be more engaging, the youth will be involved, the policymakers, the community engagement will be very vibrant, because we shall use social behavior change communication strategies. And finally, we will have a transformed community with structural change for enjoyment of human rights and social justice. This is a proposal that we may feminize the policies, and because we are talking about gender, we are talking about both men and women, only that the women's issues may be emphasized for us to have a socially inclusive, sustainable, and equitable livelihood beyond COVID-19. Thank you.
Thank you, Dr. Tufena. Now we are running very much late. So we have about 4 questions and comments in the Q&A section. So let's respond to that and we'll close the session. So there is a question from Jemima Kienu. I'm wondering how the return of people to rural areas resulted in strain on the land and resources. One might have expected that this would have momentarily reversed the previous rural-urban migration. and that it would have resulted in more manpower to attend to gardens, work in the rural areas, and so on. So, Prof. Jude, if you can respond to that, or Dr. Jerome. Was there any social impact resulting from, there is a second question. So if you can respond to the first one, Prof. Jude.
I haven't seen the questions properly.
In the Q&A.
I have been looking for them, but I didn't find them. Kindly read it for me.
How did the return of people to rural areas in Uganda during the lockdown result in a greater burden rather than increasing manpower to support farming activities during that period? That's what Jemima is referring to.
Initially, there was no problem with food, but when people returned, the food was no longer enough for the families. Some pressure was imposed on the food resources. Secondly, some of the people who returned engaged in criminal activity. In fact, they said those youth from the city centers are the ones causing insecurity because they have no livelihood here. Thirdly, some of the youth who returned had not established themselves in agriculture. They took to brick making and charcoal burning, but that resulted into the cutting of trees and degradation of wetland resources where they excavate the clay for bricklaying. Finally, water. There is usually a village well, but normally enough or cleared enough to service the population of the village that is continuous. When a lot of people move from the urban areas to the village areas, some of the water resources were drained up, and then people had to move further, a longer distance, to be able to get water. Thank you.
Thank you, Prof. The second question is, were there any social impact resulting from days of household heads or parents, resulting in some child-headed homes or similar outcomes of COVID? So due to COVID-19, yes, Prof, please.
Thank you. The response to COVID created vulnerability, especially with regard to food at home and other basic life-sustaining resources, with the results of family separation. And the separations happened in 3 strands. In some instances, a family would agree that the mother and the children relocate to the village because they cannot be sustained off farm in the city centers. In the second strand, a family would split up when the husband disappears because of inability to meet the frequent demands. Or the family lived in a rented apartment in a city center or semi-urban area, and when they could not afford to pay the house rents, the landlord sent them away and they went separate directions. The man towards his people, the woman with the children towards her people. It did not result in 2 child-headed households, or we did not encounter them because we interviewed youth, but those are the instances of separation, and they came with a lot of ripple effects, like people who went into prostitution, others went into adultery, they left their marriages for others, primarily to secure a livelihood. Thank you.
Thank you, Prof. I hope, Jemima, your question is answered. There is another, it's a comment actually. Thank you so much for the 3 presentations. You didn't highlight the escalating teenage pregnancy situation in East Africa. I work with Slum Youth Rehabilitation and Development Organization, CRDO, and incest was rampant in COVID, and most girls got pregnant by their fathers or the extended family members. This should have been highlighted in the report and the findings. That's a comment from.
I like to weigh in.
Yeah, Malcolm, sir, you can,
yeah. Due to shortage of time, we have not said much about it, but we have tried to show the significance of the problem even by building conceptual framework, which is highly related with GBV and home drinking school closure of schools, the impact of staying with home in a confined space with even family members has resulted in unwanted pregnancy, and the like. We have tried to present it, but due to shortage of time, we haven't discussed this much. You can find the presentations from the link Alamu shared you. But in addition, I want just to say something about the impact of the COVID with a quote from one of our key informants. Especially they focused on the socio-economic impact and especially on the social values. I like to quote one of our social worker key informant. Our social value has eroded. Several social support mechanisms were disrupted, including Edder, Iqub, and coffee ceremony. These are local social gathering ways. Coffee ceremony or bunatatu has a big social value apart from the talk and means of get together. In our project, we had discussed with our beneficiaries aim to do a form of need assessment. What we understand from one family is that the value of bunatatu or kefu ceremony, by which families used it to feed their children from the piece of food served during coffee ceremony. At COVID time, there was no bunatatu ceremony, which exposed these families to lose this golden opportunity to feed their children. This was one of the experiences shared by our community worker, and the COVID impact can be captured within such first-hand experiences. That's what I want to add. Thank you, Alamu.
Thank you, Mulkansra. I hope all the questions and comments have been responded to. There are no other questions and comments. I would like to thank all of the presenters and all the participants for the very fruitful discussion we had today. All the research reports, as I have indicated earlier, are available on the project website along with the synthesis infographics. You can go to the link that we have provided in the chat area to access the reports. And please go to the link and provide any, read the reports and the infographics and send us your feedbacks or comments if you have any. We'll try to respond back to you. I thank you all and wish you all the best and a good evening. If Dr. Trufena, you want to say to close the session, I'll leave the floor for you, Dr. Trufena.
I just want to re-emphasize, thank you very much for finding time to also listen to us and being our esteemed partners. Thank you for the support that you have given us and you're continuing to give us. Expect us to now move from research to community engagement. We are coming to you. We are starting with Kenya mid-June. Thank you very much. Please read our reports, critique them, and share your ideas with us so that we improve them and make them better. Thank you.
Thank you, Doctor.
There is a comment here. It might be great to have a quick Q&A on your website for some days in case people may have more to discuss. Let's give you our address so you can send it to info@austria.net, or you can send it to Trufena@austria.net, or you can send it to me also, alamu@austria.net. I'm just typing it in there. There you are. Thank you so much, and wish you all the best and a good evening for everyone. Thanks. Thank you.
Thank you, everyone.
Thank you. Bye. Thank you and
Bye-bye.
bye.